to the Conception Channel podcast.
Hello, everybody. Welcome to another Conception Channel podcast. I'm your host, Spence Pentland. This is brought to you by the Being Fertile program and Yin Still Reproductive Wellness. We have the privilege today of having our special guest, Katherine Alexander Anderson. Welcome to the show.
Yeah, thank you so much, Spence.
Excellent. So I'm excited for you to be here. I've seen you speak, and we've known each other through various means over a number of years now, and more now, which is great. But we're going to be, or Katherine's going to be sharing her insights into from many years of clinical practice, specializing in reproductive health, but today in particular with unexplained infertility. And I know in my practice that's what I'm not sure if it's technically a diagnosis, but what we see more than anything else, and that can be really frustrating, but in some senses really a positive thing, because with Chinese medicine, there's lots that can help support these ladies. But and we'll go into some other things too. But just a little bit of background for Katherine here. She's 10 years plus in her current clinics in both Maine and New Hampshire, which I've got a geography lesson before we hit record. Thank you. Specializing in reproductive health. She's had a extensive background in the medical world prior to that, and maybe you can touch on that in a second here, Katherine. Currently, she's the president of the American Board of Oriental Reproductive Medicine, specialization board that certifies natural health practitioners in the treatment of reproductive health, and speaking all over the world because just the invites keep coming. So congratulations on all that. And so I'm going to turn the mic over to you a little bit. Do you want to kind of fill in a little bit on, everybody, just so they kind of know a bit of your journey to where you're at today and what you're doing in your clinic with the ladies that you're helping?
Yeah. So let's see. Yeah, I've been started, learning more about Chinese medicine probably 15 years ago. Mm-hmm. But prior to that, I had been in Western healthcare. I had a degree in health management and policy and a master's degree in business, and was running nursing homes to start, and then overseeing a chain of nursing homes. So working for a company in which, I was managing their operations. So I was involved in direct patient care, but from a slightly different angle. So when I went to Chinese medical school, I was, kind of this black sheep, because I was just coming at it from a different perspective. But having had my own personal fertility challenges, that's really what brought me to Chinese medicine. Okay. And, I always tell the story that, a mentor of mine, Dr. Randine Lewis, I ended up at one of her retreats, and that's how I found Chinese medicine. And what a great introduction, that was. Anybody that knows Randine, she's very caring, and, brilliant practitioner. Yeah. So I, had my own struggles, and with the success of Chinese medicine, I knew right then that, I didn't want to be on the other side of healthcare anymore. I didn't want to be on that management side per se. Right. And so I wrote a business plan to start my own clinic, treating women specifically for infertility, and went to Chinese medical school with that understanding. And here I am.
Awesome. So what's the name of your clinic? And you have two of them?
Yeah.
Right.
So the name of my clinic is called Rhythms, and I have clinics both in the Portsmouth, New Hampshire area, and also in Maine, Kennebunk, just south of Portland, Maine. Okay,
great. And you've got some other practitioners I know there with you. Okay, so and you specialize. Your practice specializes, and has in the reproductive health. That's interesting, that connection with Randine. I mean, for those of you watching or listening who don't know about Randine Lewis, she is a real pioneer in bringing traditional Chinese medicine to the public and helping women that were struggling with conception. She wrote The Infertility Cure, and she's like just such a fantastic person. I love Randine. Shout out to Randine. But I didn't realize that was your story. So thank you for sharing that was your entrance into treating fertility. So by any chance, okay, just a nice segue, and we'll give links to any resources that we talk about, including your clinic, in the show notes below. But you also have something that called the Fertile Truth. Can you speak to that a little bit? I'm just curious, mostly.
Yeah. So I just recently launched that.
Oh,
that
okay. Yep.
Has been around for many years in my head, and really just grew out of discussions with patients and my passion for helping patients. And, oftentimes I can get a little charged up about some of these conversations, especially patients that have come to me with incomplete diagnoses or what I think is care that just hasn't been top notch. And so, I'm always advocating for my patients to, be their own best advocate.
Right.
And so I just, started thinking about, gosh, I really want to try and connect with patients and give them the fertile truth, right? Because the fertile truth isn't necessarily taking a ton of supplements, and it isn't necessarily, doing a million different things. Mm-hmm. It's really, getting targeted, focused treatment, in my opinion, from somebody that really, has an expertise in this area. Otherwise, you might be wasting your time and money. Yeah. And so that grew out of my clinical experience, my personal passion for infertility, and really also from the science, because I am, the way I practice is integratively. So I like evidence behind what I do. And there's a lot of evidence for Chinese medicine, and there's a lot of evidence, in Western medicine. Yeah. And so, I like to use that evidence so that I am giving my patients and recommending to them the best care possible.
Yeah. You touch on, being a resource that is experienced and that is specialized, which I think this is a great segue for ABORM. But because of pioneers in our industry, from everyone from Randine to yourself to Ray to I might squeak my name in there just a little bit, but I mean just lots of us that have put the time in, to and Lee, and Paul, and doing the research and really pounding the pavement and communicating the message, that what we've helped create is an industry where I think the public is really gaining a trust in traditional Chinese medicine and how it can aid, women and couples experiencing reproductive challenges. But the slippery slope there that I have seen is that every acupuncturist that I know now on their website has that, listed as one of their main specialties, whether they've been in practice for a year or 2 months or 20 years, and which is fantastic. But segue to the American Board of Oriental Reproductive Medicine, I think our founder, Ray, who really went through a lot. I remember interviewing him in about 2006, I think, on a podcast before they were called podcasts, when he was working on forming the ABORM. I think it was around then, maybe a little later. But and the heat that was being given for that, but the tireless efforts he put toward, because foreseeing that it was important that women understood and trusted, traditional Chinese medicine as a whole, and that practitioners had some form or some way to certify and specialize in that field and show minimum standards for competency, so the public could trust. So you're the president of the ABORM now, and so can you express kind of the ABORM's what it is and its mandate for the public?
Yeah. So So yes, Ray had quite a challenge, and he did an amazing job. Ray and some others that were significant, incorporated the ABORM back in 2007, and so for over 10 years, he was the founder and the executive director. There had been, a few presidents prior to myself. But really, we are a nonprofit voluntary membership organization. So what that means is, it means that, as a Chinese medicine practitioner, you don't need to have an ABORM certification or membership to treat infertility. However, Ray started the organization to bring a higher level of standard of care to fertility patients by making sure that those of us that treat infertility routinely are doing so with a minimum level of competence and knowledge in both Western and Eastern reproductive medicine. So it's not to say that that other practitioners that say they treat fertility aren't qualified, but it is, again, and this goes back to my patients being their own best advocate. Just because someone says on their website that they are, treat fertility and that is a specialty of theirs, you should vet that person just as you would vet anybody else. Meaning, if you're going to hire a plumber, you want to make sure you're getting the best plumber. You want to get the best electrician. And so, part of ABORM's mission was to really set that standard. And that standard, again, I wasn't involved when they started the organization, but, according to stories from Ray, that it was really the patients and the Western docs, the reproductive endocrinologists, that were really, asking for this information because they weren't comfortable referring to just anybody.
Right.
And so we really wanted to let them know, look, we have training. Our members have to pass a rigorous 5-hour exam to become certified. And, we don't just give that certification away. There are people that unfortunately don't pass that exam because, we're not trying to measure your expertise. We're trying to measure a minimum level of competence.
Right.
There are times in which, if you don't know what you're doing, you might, hurt somebody's IVF cycle, for example, and not help it. So really having that expertise is important.
And wow, has come such a long way. I remember, the times where, trying to simply communicate with IVF docs or reproductive endocrinologists, back 2004, and Lauren and I but to today, where so many of our traditional Chinese medicine and naturopathic doctors and MDs and fertility clinics, IVF clinics are working together for the benefit of the patient. And that's really the bottom line, right? Let's try and get to this to help people start their families or expand them, because that's really the end goal. And Chinese medicine, bottom line, has some good evidence and some, effective treatments to help with that. So thank you so much for the ABORM piece. If you're aborm.org, I can put that in the show notes as well too. That's if you are looking for a certified practitioner in your area, you can go there and there's listings. But just quickly jumping over to you're writing an article, and we touched on that. We talk about unexplained infertility. You recently wrote an article and got it published in a Chinese medicine journal, and it's about unexplained infertility. That is so prevalent, and I know that Chinese medicine has a lot to do or a lot to help with in that diagnosis. So what was your article about?
Oh, well.
Can you read it? Maybe we could link to it.
It should be published. It should be coming out at the October issue, so I would imagine that it's going to be coming out any day. So that was interesting. That came out of a talk that I did at the TCM Congress, which is one of the oldest Chinese medicine conferences in the world. I think next year's their 50th anniversary.
In Germany, right? Yeah.
Yeah, and so. But unexplained infertility, it's so complicated. I did a lot of research for the talk and for this subsequent article. because I really wanted to help Chinese medicine practitioners really understand. And again, I'm preaching to the choir in some sense, because we know that Chinese medicine is great for that condition, but a couple of unexplained infertility can be, the statistics vary, but it can be, up to 30% of couples that are trying to conceive may be diagnosed with unexplained infertility.
Mm-hmm.
And that diagnosis is really a diagnosis of exclusion, meaning, the doctors have ruled out certain things. They've ruled out that a woman's fallopian tubes are open. They've ruled out, or I should say, are closed. They've ensured that a woman is actually ovulating, and they've also looked at the sperm analysis and checked to make sure that the sperm is within normal parameters. Now, that's a whole other, there's a lot of detail in that. A sperm analysis, for example, is not a fertility test. They're just sort of guidelines.
That's a separate talk. Yeah.
that's a separate. That's another whole talk. So there's a lot of things that came out of that, which again, we could spend a whole hour talking about that. I could share with you a couple of sort of tidbits. So I think, first of all, when it comes to infertility, we think that we always just assume that it's the woman, which, those of us know that 30, 40, 50% of the time, it can be the male can be the issue or a contributing issue.
Mm-hmm.
When it comes to unexplained infertility by the male, that can be, they've said if a male has been diagnosed with unexplained infertility, 40 to 45% can be, unexplained.
Right.
And with a female, they're saying of all female patients trying to conceive, maybe up to 10% of it is unexplained.
Right.
But one of the important things that I like to drive home to my patients is, again, being your own best advocate and questioning the information that you're getting. It's okay to question your gynecologist. Oftentimes, patients will come to my clinic with a diagnosis of unexplained infertility. Mm-hmm. And what I will find is that particular patient situation is not necessarily unexplained. It has been unexplored.
Unexplored infertility.
The doctor has not really looked hard enough to find something.
Right.
And then when I start digging, I'm like this fertility detective. And when I start digging and getting more into things, I uncover things. Two of the most common things that I find when a patient comes and says they have unexplained infertility is Pcos and subtle endometriosis, meaning a patient might not have the classic signs and symptoms of endometriosis with super painful periods, but it's just more of a subtle condition, and that's interfering with their fertility. Right.
Well, from a traditional Chinese perspective, when someone comes in with that, I love that unexplored infertility, and that's maybe how our Chinese medicine community should frame it, because when a patient comes in with that diagnosis, it can be frustrating, but from a traditional Chinese perspective, there's no such thing. People present with patterns, and no one is void of them. So we can always look holistically and help improve people's overall health and in turn, their fertility. So, I agree that, PCOS, endometriosis, a lot of people with weight management issues, or they'll get an unexplained diagnosis. I see often even when a man hasn't had any workup, or I've got unexplained infertility and I'm 42 years old, or I've got unexplained infertility, but I was told I had diminished ovarian reserve. And so unexplained infertility, it's used very, very loosely, but with traditional Chinese medicine, we always have a path that we can take to help people. And can you explain kind of how you would approach, a woman coming into your clinic that says, I have got unexplained infertility, and my friend told me to come and see you, that you might be able to help?
Yeah. So Well, I always say when I'm treating infertility, patient comes in with a diagnosis, and when I'm treating them according to three things, right? So first, I'm treating them according to what's their constitutional diagnosis in Chinese medicine, right? So I'm asking all of these questions, looking at the tongue and pulse, and I'm figuring out what their constitutional diagnosis. Then I'm looking at their menstrual cycle, and I'm always saying, okay, where are they at in their menstrual cycle? So each week of their cycle, something different's going on. And then I'm looking at them again, what's acute that particular week. But in Chinese medicine, the menstrual cycle is the foundation of one's fertility. And again, when you first get out of Chinese medical school, you say, "Oh, I'm going to treat fertility, and I'm just going to regulate their menstrual cycle, and all's going to be well." Well, that's sort of like step one. There's so much more to that. And so, but that is important, so I will look at what their cycle's like and compare it to what I think is, again, more of the norm to us in Chinese medicine. But then I start inquiring about many different things. And I'm sort of a checklist person. I have checklists in my clinic that I use for different things, and unexplained infertility is one of them as well. So I'll, go through certain things in terms of what kind of products they're using in their home, whether they're using plastics, whether they're what kind of makeup products, food products. There's all sorts of environmental toxins that are common these days. I'll get down to the nitty gritty and talk about intercourse and timing. Now, it sounds like a dumb question, but there's no dumb questions when a patient asks me, when should I be having sex? Some women don't know. They don't know when they're ovulating. So we'll go through that and figure out when would be the best time. I'll have them start charting their cycles. And so, we'll ask them if they're using any spermicides. That's something that might interfere with the sperm's ability to actually, and what I mean is like vaginal lubricants, with the sperm's ability to get where it's going. So my list goes on and on and on, but we'll start digging into some of the details that, the Western doctors don't care. They just ask, are you menstruating or are you not? And sort of leave it at that.
So then you're ovulating. The rabbit hole of environmental toxins and how they could be impacting not just the woman and her health, and then in first trimester pregnancy being very important, but the male, the sperm, our little swimmers, I think are quite sensitive. So considering what, if you can read the label of what you're rubbing into your genitals in the shower every morning is an important piece, and so thank you for touching on that. I've got another podcast about those kinds of things, and I'm passionate about that because often it's great when you start and we do acupuncture, we might utilize Chinese herbal medicine and maybe some basic supplements and trying to keep it simple. Do you take some deep breaths, drink enough water? But it's nice to start with, to not overwhelm yourself. Here's some things you can do that are just taking things away from your life, So let's look at your personal care products and your household cleaners and things first, and maybe we can just swap some of those out for more natural things, and that might have an impact on your fertility, long-term health. Basically, if you wouldn't be using it on your newborn baby, you shouldn't use it on yourself, right?
I think one of the biggest things that, for me that came out of this article, which, we sort of know anyways, but is this whole idea of oxidative stress. The supplement industry, I'm preparing a talk for next year on supplements, and are we way over prescribing them and using them? And, the supplement industry is a multi-billion-dollar industry, and it doesn't mean that supplements are bad, but they need to be used judiciously. And, this whole idea of oxidative stress and how that's, we all need to be taking a ton of antioxidants. Well, oxidative stress, I think, is rampant because of many, many reasons. I mean, just cellular division creates oxidative stress in the body. However, the environment, our cell phones, our computers, the foods we eat, et cetera, all contributes to oxidative stress in our body. But the immune system is designed so that there should be this balance between reactive oxygen and antioxidant. And so I always, there's testing that can be done to test your oxidative stress levels. And so, even though some of the research that I found on unexplained infertility says that, high sperm DNA damage can be pretty prevalent these days, and oxidative stress, has been implicated in, 20 or 30% of unexplained infertility cases.
Yeah.
That doesn't mean that we all just go and self-supplement with a ton of over-the-counter antioxidants. Food is always the best way to combat that first and foremost. And then, talk with your practitioner about perhaps doing some testing to see if you even need supplements.
Yeah, micronutrient testing. Maybe it's costly, but if maybe you just need, to take a multivitamin, you'll be fine.
and again, if you can't afford that testing, I think a good Chinese medicine practitioner that specializes can help you figure out what supplements you might need in moderation, so that you're not doing more harm than good.
Yeah. And, I love, looking at our traditional Chinese herbal medicine as well as a whole food supplementation that is catered to the individual, because it's nothing more than, herbs and medicinal substances chock full of everything from antioxidants to, I'm not sure what that beeping is, antioxidants to minerals and vitamins that really help, in a plethora of ways, as well as individualizing it so that the needs of that person are addressed there too. I couldn't agree more that we've got this caution to over supplementation, and that is something I see a lot of people frustrated with, some because it's hard to sustain taking 15 pills a day or whatever it might be, and but there's so much else that we can do, and you were talking about it, and it might boil down to simply, like you said, the looking holistically, like turning over every stone. Simply, I had 2 new nurses as patients this week, and they both wanted to go through what happens in the body so they can observe it when ovulation happens, because they weren't clear on that. These are nurses, and so don't ever be shy to ask questions like that, because if it's just something as simple as timing, or that you notice that you're not getting cervical fluid, because that is necessary for it's food for sperm, it's lubrication, it helps adjust pH. There's so much to it. It's sometimes these little things that an experienced practitioner will just kind of have a system to go through and make sure that various items that may be impacting your fertility are we take a peek at, right?
Right. Yeah, absolutely. I couldn't agree with you more. There's no such thing as, really a dumb question. I think the problem often, you know, why women wait so long before they come to us. And again, you know, in Chinese medicine, I think we probably all agree. Sometimes, you know, we get patients that come to us after they've been trying to conceive for 2, 3, you know, new couple came in today, 6 years they've been trying. Right. Before they seek help. And, you know, I always say, like, when I'm done changing the world, they're going to start, you know, when they're young. I mean, having worked in China in the hospital, I mean, the young girls come in at age 16. They're not trying to get pregnant, but they come in with their basal body temperature charts because they know something's not quite right. And they talk to the doctor because they want to get a handle on it. You know, so I would love that to be built into our culture here. The menstrual cycle, you know, should be recognized as a 5th vital sign. And we just do a bad job right now teaching men and women about their fertility and their bodies. And so
it really, you know, even unexplained infertility, I mean, PCOS, endometriosis, a lot of these conditions, they're a clear opportunity to okay, I need to look at my health, you know, but unexplained infertility is great there as well. But it only when someone that's knowledgeable can help you look holistically at your life can kind of unpack that. And you know, on the male side, a woman has a menstrual cycle, you know, that you can observe, and it gives a lot of feedback on you know, your health overall, and what's kind of happening with your hormones, and it gives a picture, you know. With men, that's a little more difficult, but I see fertility as an opportunity. You know, when they get a semen analysis and some parameters are off, it's a really golden opportunity for them to explore their health a little deeper, because often men don't ever see a specialist or a urologist until they're in their 40s or 50s and they're having trouble going to the bathroom or something, but a semen analysis, more and more is being, that has parameters are off that are more and more being correlated to the possibility of future, health concerns. So it's an opportunity to explore at a younger age and hopefully, thwart, future concerns and a time to look at health. And bottom line, there's no better gift as a parent when you're becoming a parent or wanting to become a parent, to work on your whole health now, because we know pretty conclusively that mom and dad's health, we've known in Chinese medicine for a long time, pre-evanescence we call it, but that mom and dad's health before conception largely determines that the health that child will experience throughout their life, So this brings me to the impact of whole systems Chinese medicine. Chinese medicine is not just acupuncture and herbs. It is everything from maybe looking at and educating about ovulation to toxins to supplements to acupuncture herbs and dabbling into venturing into what's going on in people's spiritual lives even, and you're looking at that on how that affects time to conception. Is that right with your thesis?
Yeah, so I'm doing my PhD thesis right now, and I always educate my patients when they come in, because people come in and they say, I want acupuncture, right? And so I educate them that acupuncture is a wonderful modality, and I use it all the time. But Chinese medicine is really about 4 modalities, right? If you see a Chinese medical doctor in China, they might employ all of these strategies, and acupuncture is just one of them. Chinese herbal medicine is a second. Nutritional therapy is huge. And then what I call, sort of like lifestyle. I say like yoga, qigong, meditation, anything else that affects your lifestyle. Yeah. So I'll incorporate all of those in my treatments when I'm treating someone for fertility. Yeah. And, one of our colleagues did some research on what she called whole systems traditional Chinese medicine, but she did it, she did a retrospective study, and she looked at patients that were undergoing IVF. Utilizing not just acupuncture, but the whole systems traditional Chinese medicine. And she found that the odds to conception were increased when using the whole medicine, not just one piece of it. But there's no other research out there. So there's this gap in the research area showing, the use of whole systems traditional Chinese medicine on time to conception and conception in general outside of IVF. Right. So that's what I'm studying now over the next year, and I anticipate that I'll find some a lot of positive feedback and associations from that, because as we can all attest, we have many cases. If we pooled all of our success cases together from ABORM practitioners alone, gosh, I could imagine there's hundreds of thousands of women that have been helped. Yeah,
we need a centralized database. I mean, whole systems, really, there is some a body of research out there on how psychological counseling can help with fertility. There's a body of research out there on, thanks to Alice Domar and kind of her gang, on mind-body and fertility, and definitely supplementation and vitamins and minerals and antioxidants and these things and then to acupuncture. But really, what whole systems traditional Chinese medicine does is brings all of this together and looks at stress and also has a big educational component. So there's in our clinic, we've kind of boiled it down to these 10 steps to make sure as a practitioner that we cover all of our bases with our patients, because there isn't a piece that should be left out. And we get the same thing. Acupuncture's safe. It's got some research. That's what I want. But it's the beautiful part of what we do as traditional Chinese medicine practitioners is we get, a fair amount of time to connect with our patients, and we can really dive deep. Of everything from, we look at the body, we take care of that jing, and then we can get to know them mentally and emotionally, and try to help from those perspectives as well, and always referring out to resources that are better equipped to help with certain trauma or psychological issues or issues with the pelvis with a chiropractor, maybe, who knows. But then once you really gain trust with someone, the connection and the exploration of that spiritual component that might be affecting them, very Confucius kind of lineage. How's their relationships with their family, and how's work treating them, and are they fulfilled in their career? Are they happy in their relationship? All kinds of things. So it's so many lifetime friends have come from my practice. I'm not sure if that's the same with you or not, but
yeah, it is the same. And we're really fortunate. We do have the opportunity. We get more than 5 minutes with a patient,
yeah.
And I think that's really important to their care as well, because sometimes I don't even uncover something going on with a patient until 3, 4, 5 visits, in, because they, for whatever reason, just didn't think it was relevant.
Yeah.
But it is, and it's all important.
So this is, today, Unexplained Infertility, I think, period, was a good segue into holistic perspective. Obviously ovaries and the uterus and the sperm matter, and anyone experiencing infertility or difficulty conceiving has a lot of options and avenues to explore as far as medical testing and to rule out some of the obvious, but when you get to a place of unexplained infertility or even Pcos or endometriosis, there's so much that is within a patient's control and power to work with themselves and work with practitioners like yourself to help optimize, not only to get pregnant, but to optimize, their health during a pregnancy as well, and then even beyond, the child's health and the health they'll experience postpartum and how they'll recover. And it's an opportunity to really connect with both man and woman. So do you get men into your practice quite a bit as well to try and help with their condition?
I do. I try to get them in as much as possible. And we have some stubborn men that won't come in for whatever reason.
No.
But yeah, but as often as possible. I mean, if money and whatnot were no issue for couples, I would treat the couple 100% of the time. Yeah. I mean, it takes a healthy egg and a healthy sperm to make a healthy baby, and we're all over. We're doing way too much in our lives. And so everybody's stressed. So at a minimum, if I can just help people relax. And, the great thing about treating men is the sperm regenerates in, every 70 days or so. And so, if somebody, I've seen great success rates with helping men improve their sperm counts, motility, and we can do it fairly quickly, much more quickly than sometimes if we're trying to have an impact on the women. But I would always include them, and I wish that we could get them in more. So I think it's important for all you women out there to stress to your husbands. And there's a lot of research around this stuff. Sometimes I hear that like, well, there's no research, but there really is a lot of research to support that what we can do to help male sperm is really amazing.
It's substantial. I mean, the alternative. I think often men, even if semen analysis is somewhat borderline, they'll be told that it's fine, and I understand that, and that's coming from a medical standpoint of, well, we can always employ IVF or ICSI, which is a specialized form of IVF that's often used when there's poor sperm parameters, to help. It's more of a overcoming the lesser quality sperm hurdle than it is any sort of cure, and that comes with some cautions as well. So it's always, if we can work with the men too. And if a man, often a man will say, well, my sperm's fine, I don't need to do anything, and maybe they're just afraid of acupuncture needles. But even if sperm is fine, and there's seemingly something going on, maybe on the female side, another way to compensate for a possible deficiency on the female side is to optimize sperm. Sperm could be super sperm. you know, so
Yeah.
and maybe that would be, what an egg needs is healthier sperm to
Yeah,
survive.
and I run across this all the time. I have patients that come in and they say, "Oh, my husband's fine. Like we're going to do ICSI, so it doesn't matter." And I said, "It doesn't matter. Of course it matters. If I can give the reproductive endocrinologist the maximum amount of healthy sperm to
Yeah.
work with,
Yeah.
why would that not matter?
Yeah.
Of course it would matter.
Yeah.
So yeah, it's still important."
Yeah, absolutely. And I think, as a whole, everyone's kind of leaning toward that. And if you're working with an REI that is open, be open with them about what's happening and what you're doing. I mean, they're always going to advocate for you to be healthier, for you to be less stressed, for you to, lose some weight if that is an important factor, especially for retrieval medications, for your husband to be supportive, and this is what I see, just the trend in the REI and IVF, physician and especially nurse and support staff world as well. And is that your experience out on the East Coast?
Well, they're a little slower out here on the East Coast. I think, I do have some good reproductive docs that I work with. Yeah, sometimes they're a little bit slower on some of the things that you guys on the West Coast seem to be far advanced sometimes.
Right.
But we do have some good doctors here, and most of them are pretty open in terms of what I recommend. I had a reproductive doctor call me, about 6 months ago and I had been just doing acupuncture on this patient, and he called me and he said, look, I think she has an implantation issue. She has repeated failed IVFs.
Right.
Do you think you can do some herbs with her for a few months to help?
Excellent. That's fantastic.
And I thought, that's brilliant, right?
Yeah.
So,
Yeah. Mm-hmm.
Yes, absolutely.
Well, I mean, there's just so much that can be done in that case. I mean, maybe, immune regulation and, some of the invigorating blood or thinning blood qualities may combined help with any sort of, even subclinical autoimmune or condition that might have been causing the repeated implantation failure.
Yes.
Okay, that's brilliant. That's great. Well, awesome. So we've gone through unexplained infertility and how find someone in the ABORM, if you are exploring Chinese medicine to help you explain or further explore your unexplained or unexplored infertility, and how that whole systems approach. I am excited to see, because I loved Lee's research about the whole systems outperforming acupuncture alone, and obviously just the control arm of just IVF as well, which is fantastic, and that was well powered and retrospective nonetheless. But and just so indebted to you for the work you're doing with the ABORM and continuing on with Ray's legacy. That's so appreciated, and to help further educate physicians and the public that Chinese medicine is doing their due diligence to achieve the goals of our patients, just like any other qualified medical practitioner is. And but specialization is important. Thank you so much.
Yeah, you're welcome. You're welcome.
Any parting words, or we will be giving links to. I'll put links to ABORM and the Fertile Truth and your clinic in the show notes if people want to learn a bit more about Katherine or know someone in Maine, New Hampshire that want to refer her way, or just want to contact her, maybe have a question or two. I don't know if you're open to fielding, but I just kind of announced it to the world, so I apologize. But,
as long as I don't get 5,000 calls, how many viewers do you have, Spence?
Yes, it'll be unexplained infertility, I am sure. But and always, we're open to contact or questions for sure. But
I think just one more thing about the ABORM. I just think we have nearly, I think maybe even we're pushing close to 400 members worldwide.
Mm-hmm.
I mean, we have. I don't know if you have an international audience, but we have members in Switzerland, Germany, mm-hmm. Australia. England, obviously the U.S., Canada. We're growing, and it's it's wonderful because, there's so many infertility patients worldwide, and to be able to offer them the best care possible. And again, I don't know, I'm sure other practitioners are like me in that, when we, sometimes patients come to me and I do my sleuthing and I find like, look, you don't have any sperm. Yeah. Like there's no sperm. Yeah. Like I'm not sure what else I can do. And so we might refer them off. So we're sort of this triage standpoint where we're trying to figure out where they can get the best care.
Yeah. Well, when there's experience, you understand the resources in your community, all of them. And, so I often tell patients right off the bat, I'm a supportive liaison for your whole journey. So if you've got questions about anything, if I don't have the answer, I know someone who can help you.
That's perfect.
And that is, that's huge. Gone are the days of, if you want to explore traditional Chinese medicine, wandering down a back alley in Chinatown and finding someone that knows no English to perform medicine on you, which fine. But, ask your REIs or your IVF docs, who they work with, who they refer to. Check out the ABORM.org for practitioners in your area that are certified with that body or that board. Thank you for that message. That's so great. We'll like I said, I want to get you back on for a different podcast, but for today, thank you so much. This has been wonderful.
You're welcome. Yeah, thank you so much, Spence. It was fun talking to you.
Excellent. We'll get you on the show again soon. Take care, Katherine.
All right. Yeah. Bye-bye.